The ADA states diabetes affects over 29 million Americans. For tips on a healthier diet, exercise that will keep you active, and prevention of this disease, stay with us today on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps it giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Today on the show we're talking all things diabetes because this is such an important topic that affects almost a tenth of the population here in America. So I decided to bring in a panel of experts to chat all about it. First of all, let me introduce you to Dr. Simon Fisher, Chief Division of Endocrinology, Metabolism and Diabetes, Professor of Medicine and Biochemistry, and Amy Armour, Board President of Juvenile Diabetes Research Foundation, and she also happens to have type 1 diabetes. Welcome to the show.
Good to be here.
I really appreciate that when I reached out to you that you said, Troy, this is who we need, this is what we're going to do. So you ready?
I'm ready.
It's going to be a bumpy ride,
I'm
my
ready.
friend.
Let's do it.
All right, Dr. Fisher, first of all, what is diabetes?
What is diabetes? Diabetes is defined by elevated blood sugar. So people either don't make any insulin or they don't make enough insulin and their blood sugar is elevated and it leads to complications later in life.
Why do we have such a problem here in Utah with diabetes?
I think in Utah we tend to think of ourselves as being young and fit and always outdoors and always eating the right food, but unfortunately the statistics don't back that up. Like the rest of America, we're overweight, we're sedentary, and we get insulin resistant, obese, and that leads to type 2 diabetes.
But if you have type 1, like I do,
Yeah.
then that isn't a factor in my diagnosis.
Right.
Because you're saying you're not overweight, you're a healthy looking woman. Can I
Right,
say
right.
that?
Oh,
so,
absolutely.
and that's the question, because people assume diabetes is only for overweight people.
No, well, because I said I'm type 1, I account for only, 5 to 10% of the diabetes out there. And type 1s are usually thin. They're not overweight.
Okay,
Right.
well, we took our camera crews with you to go up to Dr. Fisher's office to see what you went through for your regular checkup. Let's take a look.
Hi, Dr. Fisher. Happy to be here. Walk me through the new patient experience.
Okay, well, here at the University of Utah Diabetes Center, we have comprehensive diabetes care. So the first thing we tend to ask is figure out, when you were diagnosed, how long ago you were diagnosed with diabetes, or are you concerned that you might have diabetes? So sometimes we talk about prevention of diabetes, and sometimes we deal with actually managing people who've had diabetes for a while. So Amy, what do you have there? You're going to check your blood sugar today?
Yes, I brought my meter. So
How many times a day do you check your blood sugar?
4 times a day.
Before meals?
So I test my blood sugar when I wake up in the morning.
Excellent.
And then
What are your blood sugars in the morning when you wake up?
they're usually around 80.
Oh, okay, that's good.
So if I'm a new patient and I was just diagnosed and here I am in your office, what is the first thing that you would do?
What is the first thing we would do? Well, it's a comprehensive care program we have here. So part of it is getting, the facts. When were you diagnosed? How high were your blood sugars? How often you're checking your blood sugar? Do you have any symptoms of high blood sugar or low blood sugar? Some people have had diabetes for a long time and didn't know about it. So sometimes we talk about, do they have any complications of diabetes? So those are important things we want to know right at the beginning at a first office visit.
And in 5 seconds,
5 seconds, that's
it
pretty
tells
quick.
me what my blood sugar is. 178, okay.
So 178's a little
That's
bit high.
Yeah, that's a little high. So I should take insulin.
Yeah, if your blood sugar's a little bit high. Why do you think it's a little bit high today? Did you have a big breakfast?
Stress.
Stress.
First, I have to know what my blood sugar is. Then I have to take into consideration what I'm eating so I know how much insulin to give myself.
So do you carb count?
I carb count.
Okay.
And basically, based on the number of carbs that I'm eating, I'll take the appropriate amount of insulin to cover those carbs.
All right. So what's your carb ratio?
10 carbs for 1 unit of insulin.
So a larger meal with more carbs, you'd be
Right.
taking how many units of insulin?
So if I was eating 50 carbs, I would take 5 units of insulin.
So one of the things we just do screening is to make sure you don't have any cuts or nicks or ulcers
Okay.
on your feet. And
How,
again,
how do my feet look?
your feet look great.
Okay, good.
So this is just a little thing. It's called a Von Frey hair, and this just bends and it applies a certain amount of pressure. That again is a way to screen your feet to see whether or not you have sensation there.
Okay.
You can just put it on your finger. You can feel that, right?
Right, I can feel it.
So-
Slight, but I can feel it.
Right. So now we're just going to do the same thing with your feet.
Okay.
All right. Now the trick is we ask you to close your eyes.
Okay.
Because that way there's no cheating involved.
Okay, so should
all
I
right?
just put my foot
That's
up?
fine there, and you tell me when you feel it. All right.
Okay.
And tell me which toe I'm touching.
Oh, big toe,
Big toe. Excellent.
second toe, I think.
Yeah.
Pinky?
Yep. Very
Okay.
good. Let's try the other foot.
Well, coming up after the break, we have more from our panel, and later we'll show you what exactly a brave young man is doing to bring awareness to diabetes. Back in a moment. Looking for the perfect beauty product? Each week, The Younger You highlights a standout product in the health and beauty industry. Head over to theyounger.you.tv and check it out. Love to hear your comments. Thanks for staying with us. Well, we want to continue our discussion with our panel of diabetes experts. Dr. Fisher, this is an important question, and I think a lot of people want to know the answer. What role, if any, does genetics have to do with diabetes?
Oh, sure. Yeah. Genetics plays a very important role. We all know, hear people about their parents or their grandparents all having diabetes, and that puts them at high risk. And that's for people with type 2 diabetes, but I know Amy's going to ask me about type 1
but
diabetes.
She's going to jump in right now.
I have type 1 diabetes. There are no genetics in my family with diabetes. My
Interesting.
family, nobody in my family has diabetes.
So the genetics in type 2 diabetes is much stronger. In type 1 diabetes, there is a genetic risk, but there is something in the environment that triggers the autoimmune assault on the beta cells that destroy all the beta cells and leaving you without any insulin.
We have a lot of Pacific Islanders here in Utah. Are they predisposed?
Absolutely. They're the same thing. Genetics, family history, and that puts them at high risk of being overweight, becoming insulin resistant, and getting type 2 diabetes.
How much does that increase the risk for diabetes? I mean, is it 50%?
What, the weight gain or?
Right. If they are of that descent,
Right, I
that
get you.
ethnic descent,
Yeah.
how much more does their risk for diabetes increase?
It increases a lot, but what we say is that genetics loads the gun, but it's the environment that pulls the trigger, meaning if you diet, if you exercise, if you lose weight, keep weight off, keep an active, healthy lifestyle, you can prevent most cases of type 2 diabetes.
Well, let's see what else you got for us while you're up with Dr. Fisher. And I do believe that he explains the symptoms of different types of diabetes. Let's take a look.
So tell me about when you were first diagnosed and what you were going through at the time when you were first diagnosed,
Okay.
the symptoms you were experiencing, and what in your mind made you decide to go and see a doctor to get this checked out?
So I started getting thirsty all the time. I was constantly thirsty. I could not drink enough water. And then I realized that I was getting up in the middle of the night to go to the bathroom like 2 or 3 times, and that was not normal. And so this was years and years ago, 25 years ago. So I called my mom, and my mom said, "You need to go see the doctor." I'm so glad that I didn't wait and that I went in. And as soon as I explained these symptoms to my doctor, he said, "Let's give you a blood sugar test." And they tested my blood sugar and it was high. I had the classic symptoms.
Okay.
And I didn't know that they were diabetes. I knew that I was thirsty all the time. I was getting up in the middle of the night to go to the bathroom 2 or 3 times. And I knew that was not my regular routine, that something was wrong.
I think what's important though is for you with type 1 diabetes, the symptoms come on very suddenly and you realize something's wrong. Type 2 diabetes is a lot more subtle. It's mildly elevated blood sugars that go on over time. So eventually they do develop the symptoms that you described, but I think it's important that type 2 diabetes can come in and be checked earlier to see whether they have pre-diabetes or early diabetes, because that way you can treat them before they end up with long-term complications.
Mine were very dramatic, definitely.
Okay, what have you done to live with diabetes? Because I think you said you've had diabetes for 25 years.
25 years.
Tell us your story. How do you cope with everyday life?
So it's just, I have to live a healthy life so that I don't have complications later in life. And that means just eating healthy foods, checking my blood sugar. I wear an insulin pump, which really is great because my blood sugar is high. I'm going to use my insulin pump to take insulin, and basically I'm just going to hit it a couple times.
Okay, how much insulin are you going to take for your blood sugar being in 178 right now?
I'm going to take 1 unit, which will bring me down 60 points, down
right.
to 117, which is, you know, I think a good range. Not too low, but not too high. And then I just hit act, and then it gives me my insulin.
So, and that pumps all the way in through the tubing?
Yes, this goes all the way. I have a little insertion site right here under my shirt, and it goes into the subcutaneous layer of my skin, and it just feeds me insulin, a little bit of insulin all day, and when I need to correct or take meals, I hit a couple buttons and it gives me a jolt. I still have to do the work, but it makes it a lot easier to do the work.
I need to ask you, Dr. Fisher, what happens if that pump stops working?
So-
if you're using it all day, every day?
I sleep with it.
Oh, you sleep with
I
it as
sleep
well?
with it.
Absolutely.
Oh.
So the pump delivers insulin via tube into under her skin all day long. If the pump, is there a kink in the tubing or the pump malfunctions, it
And
sets off.
that's happened to me.
Does it set off an alarm for
It
you?
does,
So
it
it makes
does.
people aware that, hey, something's wrong with the pump, you better check it out.
Okay.
And if the pump doesn't work, they have to go back to shots.
And that's what I was just about to ask you. If you didn't have the pump, can you go back to shots automatically?
Sure.
And do you know how to use those shots?
Yes, because when you're first diagnosed, you're trained. They train you how to take a shot. There's something called an insulin pen, which is just a syringe with insulin. And sometimes you may need to use that. You know, if my pump breaks, I may need to use that.
Sure.
You're allowed to take that on the plane? There's no issues or?
I always get beeped. But
Okay.
I am allowed to take it on the plane.
All right,
yes.
incredible information, and I think we've learnt a lot so far. But after the break, we're going to swap things up a bit on the couch here because we're bringing back a dietitian and fitness professional to get their take on diabetes. Stick with us. Closed captioning of The Younger You is brought to you by Circle of Life Women's Centre.
Like us on Facebook for updates on the show and how to join the Younger You conversation.
Diabetes remains the 7th leading cause of death in the United States as of a study done in 2010, which is why we're talking all about it here today on The Younger You. Still with us is Dr. Simon Fisher and Amy Armour, but I've also asked to join us Kathy Smith, a New York Times best-selling author and the creator of an award-winning workout video line including Project U, Type 2, which focuses on exercise and diabetes, and Lacey Peterson, a registered dietitian and certified diabetes educator. Welcome to the panel, girls.
Thank you. It's great to be here.
Well, we're very happy that we've had your expertise for the next part of the show, but we reached out to our viewers and asked them to give you some questions. So how does that
Perfect.
sound? Alrighty.
All right,
Lacey, as a diabetes educator, explain how you can help someone who has been diagnosed with diabetes.
So when someone's diagnosed with diabetes, they go to their physician, and their physician gives them a prescription and recommendations. And then what they can do is they can come to me, a registered dietitian, diabetes educator, and I help them put those recommendations into practice. So we tell them, you know, the physician will tell them, check your blood sugar, eat right, exercise more, and then I help them to actually figure out what they can do and what they can change in their life to make those things happen.
So a bit like a food coach.
Yeah, food coach, a blood glucose monitoring coach.
I mean, that's what I did when I first was diagnosed. I had to be educated. And so I went to a CDE, diabetes educator, and they helped me figure out what foods I could eat, what foods, you know, to stay away from.
I think the important thing is, at least at the University of Utah, at our diabetes center there, we have a team approach. So it's not just the patient seeing their physician, they also go to see the diabetes educator, the nutritionist or certified diabetic person in charge of that, as well as the exercise physiologist, and it's really a big team approach.
And I was going to say a team approach. That's what's really important. Here's one for you, Kathy. What exercises can you do to prevent, and are there things that can be done fitness-wise if you have diabetes?
Yeah, the answer is yes and yes, but
Yes and yes and yes.
But I want to back up because you use the word exercise, and you know, people get so turned off when you hear exercise. And what I like to talk about is movement, because the important
Okay.
thing for not people with everybody, whether you have diabetes, whether you don't, for you, everybody at the panel here. Move throughout the day. All the studies are showing, get movement. Sitting is the new smoking. So that thing, sitting is the new smoking. More people die from being sedentary than they do from smoking now. And the problem is we think we're going to go for our 20-minute get going workout thing, lift those weights, and then we're going to come and sit at our office and sit in the car and sit and watch TV. And basically that sitting all day long negates a lot of the benefits from the exercise.
People talk about how do you increase your metabolism? That's how you increase your metabolism. Are there miracle foods? Not really, but strength training will increase your metabolism.
Well, I'm glad you said that, because one of the viewers' questions was, Lacey, what type of foods do you educate people with diabetes to eat?
So a lot of times with diabetes, what we're looking at is, a lot of times people come in and say, what can't I eat? And I do really like to go about the approach, what can you eat? And really, there's no special diet for diabetes. It's really just a healthy diet. So the same thing I would tell somebody who has diabetes or someone who doesn't have diabetes, I'd really tell them the same thing. You know, eat good, healthy foods. So fruits and vegetables and whole grains and lean meat. Things that are going to give you nutrition and, you know, really help your body to work the best that it can.
But are there things that you would say absolutely, do not eat this food?
I would say really the only thing I really steer people away from is really foods that have a lot of sugary substances to them, and really things that are based on syrup. So sodas, of course. So what's the main main component of soda is syrup.
Oh, syrup.
Lots of
see?
sugar.
Is that the same
Lots
as
of
sugar?
Well, yeah,
You can
it's
educate me now.
concentrated. Yeah,
All right. Well, one of my favourite parts of these type of shows that we do with the panel is we take our camera crew out to the streets for a topic what we call Man on the Streets. Take a look.
Diabetes is A, a metabolic disease, B, a sexually transmitted disease, or C, a food fungus disease.
A, metabolic disease.
It's a metabolic disease.
Yes,
Metabolic?
metabolic. How many adults 20 years or older in the U.S. have pre-diabetes? 8,600, 86,000, or 86 million?
86,000. 86,000? 86 million?
86 million.
Oh, wow.
My last question is, what ethnic population, and they are the second highest outside of Honolulu and Salt Lake City, has an increased risk for diabetes? Asians, Pacific Islanders, or African Americans?
I want to say Pacific Islanders because the Hawaiian thing.
Pacific Islanders?
African Americans.
Asians. But I'm going to go with Pacific Islanders right
Pacific Islanders.
now. All right,
You
cool.
got that one right.
Yes.
Bravo.
Thank you.
Well, right after the break, we're going to hear an incredible story from a brave young man named Ethan. Stay with us. Welcome back to the show. Before we see Ethan's story, Amy, tell us, what is your involvement with Ethan before we go to our package?
So Ethan is this great bike rider. He and his mom recruited me for the JDRF Ride to Cure Diabetes. And
Remind us what JDRF is again.
the Juvenile Diabetes Research Foundation. And it's an international foundation that raises money to find a cure for type 1 diabetes.
Okay, well, let's take a look at this incredible young man called Ethan. Take a look.
Well, when I was diagnosed, I was drinking a lot of water. I remember I was always just super thirsty. And my mom and dad thought that I might have had a bladder infection. They took me to the hospital to see, and they ran some tests and found out that I was a type 1 diabetic. My parents were a little scared and worried. Like, they didn't really understand what it was at first, but now that they're educated with it, it's not, they still worry about it, but it's not as big of a worry for them. At first I thought that I shouldn't tell people because I was worried that people wouldn't want to be my friend or I wouldn't get invited to birthday parties, but now that kids are a lot older and I can explain what it is to them and they'll understand, I don't worry about it as much now. I ride because I enjoy the fundraising, I enjoy riding with people that I'm friends with and helping a good cause. I'm going to be participating in the 4th JDRF, or Juvenile Diabetes Research Foundation, Ride to Cure. I've never really thought of diabetes as something that limits me. I've thought of it as it's a barrier, but once you overcome that barrier, you can do anything that you set your mind to, just like anybody else could.
What an incredible story this young man is. Now, you said earlier in the show that it is an old person's disease and a young person's disease, toddlers as well. But why do we think in the public that it is truly an old person's disease?
Well, often we think of our parents and grandparents who get diabetes, and that's type 2 diabetes, and that's associated with being older. Ethan obviously has type 1 diabetes. He's young and skinny and needs to be on insulin. The really scary part, though, is that as a society, as our kids now are getting fatter and more obese and exercise less, the young kids who we traditionally think of type 1 diabetes, they're actually getting adult onset or type 2 diabetes at a younger and younger age.
Partially because of our diet and lack of exercise. Everything we're talking about, you aren't getting any exercise, you're eating too many sugars, too many of the sodas that Lacey talks about,
You're
too
gaining
big
weight.
portions, you start gaining weight, and you're not quite in the pre-diabetes, the diabetes range, but you're starting, so it's a progression. You just don't wake up one day and say, oh, I got diabetes.
Well, and that's what I wanted to say, because you touched on pre-diabetes, okay? Can we get some clarification what that is and how do we know we're pre-diabetic?
So pre-diabetes is a major problem. There's 89 million Americans with pre-diabetes, and that means their blood sugar is elevated, i.e. they have the disease, but it's not quite elevated enough to consider it full-blown diabetes. Don't make no mistake about it, it's the same disease as you suggested, the same problems, but it's just early diabetes, pre-diabetes.
And also I think a lot of it, and I've heard, you know, you and other doctors and exercise experts talk about the fact that, you know, we're not moving as much. And so does that have something to do with it?
Absolutely. So again, not moving enough and not eating the right food, being sedentary, being overweight, all leads to obesity, and that predisposes people to insulin resistance and full-blown type 2 diabetes. As a registered dietitian, do you tell people to look at the labels?
Well, I do tell people to look at the labels, but a label is one thing. I want people to look at the food. What are you eating? You can make a breakfast in less than 5 minutes that's made from Whole Foods. You know, you can cook up some eggs really quickly. You can put them in the, you can even put them in the microwave.
We should do a cooking recipe. I have this great frittata recipe that you make like in a muffin tins, and this is the cook of the century,
love
by the way. But you put these frittatas, and now I take them, and they're in cupcake dish. And
grab
so
and go.
You can grab and go.
All right,
and
Kathy,
now
I want that recipe. We're going to put it online as well.
Okay.
How does that sound?
I know it for sure.
You got to email it down, my friend.
Yeah.
Or make a smoothie and just get in the car and go.
Yes.
Well, and I want to share something with you, because when I first came to America, I was fairly fit. And when I went and had my male checkup at the University of Healthcare in the men's clinic,
What happened?
he told me I was pre-diabetic.
Wow.
And that freaked me out.
So what did you do?
Yes, what drove you to action?
Decided to have this show. How does that sound?
That sounds
Because I have
great.
to say to you, you're educating me as I'm listening to you, and quite often as a host of a show, I have to butt in, but we could go on for so long, but we only have so much airtime, my friends. Thank you so much. Thank you for reaching out and educating me along with the audience as well. The effects of diabetes are sweeping, as we've learned here today. If you have signs or symptoms, please be sure you go and get a checkup with your primary care physician. For more information about the show and diabetes, please head over to our website at theyoungeryou.tv, and I'll see you next week. Coming up next week, we'll be meeting Laura and finding out why she wants to have fat transfer done on her hands and face.
The Younger You set provided by Madison McCord Interiors.